Go ahead and take a deep breath. You do this thousands of times every single day, so it feels incredibly simple. But that physical expansion sets out the chain reaction that reaches far deeper than your chest. Most of us treat the lungs as the final stop for the air we breathe. In reality, the lungs are a waiting room. The true destination for all that oxygen is actually the mitochondria, the tiny power plants locked inside every individual cell in your body. To get from the outside world all the way down into those microscopic power plants, oxygen has to travel through a highly coordinated 6-step logistics network. Doctors call this supply chain the oxygen cascade. This diagram shows how the system moves cargo without any motorized pumps. The entire network runs on pressure. We measure this in millimeters of mercury, or mmHg, which is the same way we measure the air in a car tire or the weight of the atmosphere, just on a much smaller scale. Oxygen naturally flows from high pressure to low pressure, so it simply tumbles down these steps, moving deeper into your body until it reaches that tiny low-pressure pool at the bottom, the mitochondria. If that downward flow is interrupted at any one of those 6 steps, the cargo never arrives. The cells will starve. Survival depends on every single link in the system remaining intact. Let's walk through how this supply chain actually operates. Step 1 is uptake. Think of your lungs as the body's import harbor. Because the pressure of the fresh air in the harbor is so much higher than the pressure inside your bloodstream, the oxygen is naturally forced across the border and into your blood. Once inside the blood, we hit step 2, transport. Oxygen can't just walk to the cells. It needs a vehicle. The body provides dedicated delivery trucks for this exact purpose, a specialized protein called hemoglobin packed inside your red blood cells. This animation shows exactly how cargo is handled. Notice that 98% of glowing oxygen from the lungs loads directly into red blood cell trucks. Look closely. A few stray orbs float freely in the plasma. The vast majority relies entirely on hemoglobin. Step 3 is global delivery. This is where your heart comes in. It acts as the central engine of the operation, pumping roughly 1,000 milliliters of oxygen cargo down the circulatory highway every single minute. A healthy set of lungs can load all the cargo at once, but without the infrastructure of a pumping heart and a fleet of red blood cells to move it, the oxygen is trapped at the harbor. Once the cargo is on the highway, how does it know where to go? Step 4 is exactly that, regional distribution. The body routes blood based on local demand. Your kidneys, for example, work incredibly hard to filter your blood, so they extract a massive amount of oxygen compared to rusting muscle tissue. When the trucks arrive at their destination, we reach step 5, cellular diffusion. Because the oxygen pressure inside the hungry tissues is so low, the cargo naturally offloads from the hemoglobin trucks, moving out of the bloodstream and into the cells. That brings us to the final stop, step 6, cellular utilization. The mitochondria eagerly take in that oxygen and consume it to generate the energy required for every single biological process in your body. This gauge visualizes a crucial limit doctors call the Pasteur point. It represents the absolute minimum pressure threshold required to keep cellular power plants online, usually around 1.4 millimeters of mercury. If the pressure drops below that level, the mitochondria shut down immediately. Oxygen circulating in your blood is useless on its own. Its singular, essential biological purpose is to reach and cross that final microscopic boundary into the mitochondria to power life. When cells are starved of oxygen, doctors call it hypoxia. Because the body relies on a rigid, sequential supply chain, hypoxia can happen in 4 distinct ways. This grid details 4 failures. 1. Hypoxic hypoxia. Asthma or altitude closes the lung's harbor. 2. Anemic hypoxia. Blood loss creates a truck shortage. 3. Stagnant hypoxia. A failing heart stalls loaded trucks. 4. Shunt hypoxia. Heart defects force empty trucks to bypass lungs. Diagnosing hypoxia is a complex puzzle. To save a patient, doctors have to pinpoint exactly which link in this logistics chain snapped. Which brings us to a major medical question. If a patient is struggling to get enough oxygen, why does placing a mask set to 100% oxygen often fail to save them? This animation reveals the answer. Turning up the mask only floods the lung's import harbor. But if the patient has a truck shortage or a traffic jam, extra oxygen just piles up at the docks. utterly unable to reach the starving mitochondria. True medical survival requires protecting the entire relay race. It requires honoring that complex, step-by-step journey from the open air, down the pressure staircase, and into the deepest, most microscopic corners of the human body.